many people have had COVID in the last couple of months during the second wave of the pandemic, and it's important to focus on post-COVID recovery and how to take care of yourself, as many people are experiencing symptoms that go on for months. Well, to talk more about this, we're joined by Dr. Vishakha Shivdasani, a physician, nutritionist, and author of the book COVID and Post-COVID Recovery. Thank you so much for joining us on the show, Dr. V. What are your tips for managing health post-COVID?
I think managing post-COVID has to happen from the time a person has COVID and not to wait till the post-COVID sequelae happens. So we don't need to wait for the complication to happen, because if you manage COVID correctly, the chances of having post-COVID complication or being a long hauler diminish significantly. So that's what I do with my patients. I start day one of symptom. And, then of course, if somebody is coming post and coming, to me for the first time as a long COVID patient, then we need to see why the problem is happening and what kind of problem and complication there is, because most complications during or after happen because of inflammation. And we are seeing an entire gamut of symptoms for post-COVID complications.
So if you could share with us, what are some of the common post-COVID symptoms or issues that people have come to you with? And, if you could tell us what sort of advice you give, and you talk a lot about tweaking diets and what you take in, how important that is.
Sure. So, like I said, we're seeing the entire gamut from something as small as hair fall to brain fog, insomnia, which is very common, breathlessness, tachycardia, fast heart rate, inability to exercise like they could, to, of course, clots and heart attacks. So we are seeing the entire thing. And, while some hair fall or a hacking cough or insomnia is not debilitating and may not kill you, it affects your day-to-day activity. I could be sitting here and having an interview with you, but if I was coughing, incessantly, or my skin was really scratching, it's not a way you want to live your life. So these are real problems and they need to be tackled. So what I have done is I have come up with a 6-point plan to deal with this, which takes care of inflammation and therefore will take care of your complications, irrespective of what complications you have. So the 6-point plan, like you said, of course, covers nutrition, but also covers taking care of gut health, sleep management, stress reduction, exercise, and healing with supplements, all of which play a role in reducing inflammation and therefore increasing and improving outcomes of the complication. So specifically,
right.
If you'd like to ask me specifically, then I can tell you what's,
I wanted to actually
symptoms.
ask you, we've had a lot of young people also get COVID, and by young, I mean, between 20 to 40 years of age, and people who are very used to being very fit, people who are used to exercising regularly, and then they get COVID, and then post-COVID, they think, they can pick up from where they left off, but that isn't right, and then they struggle, and they wonder why they're not being able to manage what they could before that. And it's important to realize that post-COVID management is very important, isn't it?
Absolutely correct. I tell all my patients, don't go from 0 to 100, because you've spent 14 days in isolation with almost no activity. So don't go from there to, especially like you said, the younger people start feeling so good, and in 14 days they feel that they have no post-COVID complications, so that they can go back to the gym and they are so keen to pump. We are seeing people who are just dropping dead. We are seeing people who get clots. So you need to work at it really slowly. And the exercise has to be graded every week to build your exercise tolerance slowly, even if you're feeling fit. Because the people in the second wave, especially the ones that we have seen, who've got mild symptoms or even asymptomatic, they are the ones who are left with these post-COVID complications 3 months, 6 months later. Because very often, the comorbidity is underlying. We are the diabetic capital of the world. So someone might have a blood sugar that is normal, but we don't know where the insulin levels are, which means they're pre-diabetic, or you have a beer belly, or 1 out of 5 Indian women in the childbearing age have polycystics, ovaries, and these are all comorbidities and they go undiagnosed, which is why we see the young people in the second wave who've had so many problems. So start slow, build your exercise tolerance, start with static exercises first, start with pranayam, build your exercise capacity, your lung capacity,
right.
Then increase every week. If it takes 3 months, so be it. Don't go from a 0 to 100.
Very important tip there. And you also talk about, the vaccines and care that you need to take around the vaccines. We're running out of time, but if you could briefly tell us about some of those tips.
Well, I tell everyone, first of all, please vaccinate anyone and everyone who's eligible. That's the closest way we're going to get to herd immunity. But, you need to follow a certain protocol to help enhance even the outcomes of the vaccine. We need to have antibodies against the antigen, which is the vaccine. And for that to develop even further, to get good antibodies, you need to have a good protein intake in your diet, because the antibodies are formed of protein. So if you're not going to have enough protein, adequate protein in your diet, you're going to have a less antibody production. So make sure you're eating a good diet with adequate amount of protein. Most Indians are malnourished and have low protein. I'm not saying go high protein, but good quality protein and adequate protein. Make sure you sleep well, because we know that if you're disturbed sleep, even 2 days of disturbed sleep can cause immune modulation, and can disrupt your immune function. So you need to sleep well before and after your vaccination. Do not drink at least a couple of days before and after. Don't binge drink for 45 days. Do not smoke. We know that smoking causes vasoconstriction. We know that COVID is a prothrombotic disease. Of course, we're talking only about the vaccine, but still, you need to make sure that you take care of these things. Make sure your gut is good. So your immune system, 70% of our immune system is in your gut. So make sure if you have a gut problem, take a probiotic before your vaccine. So at least your gut is functioning well. So, you have your immune system in place.
Dr. V, I'm sorry, I'm completely out of time. All very valid tips and very important tips there. Thank you so much, Dr. V, for joining us on the program.
My pleasure. My pleasure.